Hi, I'm Congresswoman Jan Schakowsky.
And I'm Congresswoman Doris Matsui. We're the co-chairs of the Congressional Task Force on Seniors.
The last time we talked with you, we celebrated the historic Affordable Care Act, Obamacare. We love Obamacare, don't we, Doris?
We love it.
And the many new benefits it brings to seniors. New benefits like the no-cost annual wellness visit, lower drug costs, free preventive services and screening for diabetes and cancer, and unprecedented new tools to fight fraud.
Today, we want to tell you about the Republican budget unveiled this month and how the Democrats are fighting to keep it from ever becoming law. We want you to know how we are working to keep the benefits provided by the Affordable Care Act, Obamacare, and to protect Medicare, Medicaid, and Social Security because, unfortunately, they are all under attack.
That's right. The Ryan Republican budget would put an end to Medicare. They still call their new scheme Medicare, but it is very different from the Medicare we know and love. AARP says the Republican plan would remove, quote, Medicare's promise of secure health care coverage, a guarantee that future seniors have contributed to through a lifetime of hard work. The National Committee to Preserve Social Security and Medicare says it would lead to Medicare's demise.
Here's how the Republican plan works. Seniors would be handed a voucher to use to buy a private insurance plan or traditional Medicare, but the cost of the voucher would be capped. Each year, it would cover a smaller and smaller portion of the premium.
And private insurers would be allowed to vary the benefits they provide. They could, for example, offer gym membership, but not the most effective diabetes drugs. That way, they could cherry-pick healthier and younger seniors, driving up costs for those who stay in the traditional Medicare. The result? Seniors' out-of-pocket costs would double. And get this, the Republicans are also proposing to raise the age of Medicare eligibility to 67.
Seniors would also pay more because the Republican plan includes the repeal of the Obamacare. Under their plan, seniors would be back to paying for preventive care services and the donut hole. The gap in Part D prescription drug coverage would be reopened and stay open. Billions of dollars in savings to seniors under Obamacare would disappear.
Seniors would also lose access to critical long-term care services. Today, 1 in 3 seniors needs financial help for services so they can stay in their own homes or in the community, or pay for nursing home care. Medicaid provides that assistance. In fact, nearly 1 in every 5 Medicaid dollars goes to help seniors pay for long-term care. Under the Republican budget, federal Medicaid spending would be capped and cut by $810 billion over the next 10 years.
Additionally, Republicans want to change the rules so that they can jam Social Security benefit cuts through Congress. 2/3 of retirees rely on Social Security for a majority of their income. They can't afford to have their earned benefits reduced.
Finally, the Republican budget makes enormous cuts in the Older Americans Act, jeopardizing everything from senior housing to Meals on Wheels and fuel assistance to training for older workers.
You're probably asking how seniors and their families can bear all these costs, or why they should be asked to bear them at the same time the Republicans want to give an average extra $150,000 tax cut to millionaires and billionaires and keep tax breaks for big oil companies.
We believe that it isn't right to take the Social Security benefits you earned or the Medicare guarantee or Medicaid long-term care services in order to give more tax breaks to the already wealthy.
That's why Democrats are fighting for a budget that protects seniors and the middle class. To learn more about our efforts, please visit our website.